Okay, so we are about to begin our ESG training webinar here, and I apologize for the slight delay. I just had some technical glitches here in getting this going. If you can hear my voice and see our screen, if you could let me know in the questions box or the chat box to the right of your screen, that would be very helpful. Okay, getting good feedback so far, so excellent. Okay, very good. Okay, thank you everybody, and welcome. We'll begin here in just a moment. Okay, so this is the Emergency Solutions Grant, or ESG, Iowa statewide training for subrecipients. And about today's webinar. Our webinar will be posted online afterwards. We are recording it, so hopefully that will work smoothly today. And then we'll also make the slides available, and we'll post those at our website at www.iowafinanceauthority.gov. And you'll want to use the drop-down menus at the top of our website for programs. Select homelessness, and then click on our ESG program at the left. Our webinar today will be followed by the opportunity for questions and answers. Anytime through the broadcast, you can also submit questions through the tab on the right-hand side of the screen. And the webinar, of course, is not intended to substitute for or to completely cover or explain all applicable rules and regulations of the program. And agencies are, of course, responsible for following all program regulations. So that's our standard disclaimer. And our presenters, I am Amber Lewis, Homeless Programs Coordinator at the Iowa Finance Authority, and I'm joined by my colleagues,
Judy Hartman
and Josh McRoberts.
Okay, and our topics today, we will include general information, budgets, draws, and documentation, types of assistance, program requirements, additional program requirements for agencies doing homelessness prevention or rapid rehousing, data collection and reporting, and a future outlook in the section there. So we're going to just jazz things up here today with some polls. So bear with us. We're hoping this will work okay. So first we want to know what best describes you? I don't know if you can see it on your screen. It's not showing on my screen. But our goal here is to figure out what best describes you. Are you the director of your agency? Are you in a fiscal position? Are you a case manager? Are you an ESG program director or other? Okay, so we're getting some responses. That's great. Not sure if they're showing up on everybody else's screen here, but we'll share in just a moment. We'll give about 10 more seconds here to respond. Okay, and it looks like the results are mostly in. We have about a quarter, about 25% are directors of their agencies. 15% are in a fiscal position. 0 case managers today. About a quarter ESG program directors, and 35% other. I'm curious about the other. But great, that's helpful for us to know. Oh, maybe it'll show on your screen now. Okay, and we have one more poll that we would appreciate your participation in, and that is, we would like you to describe your level of experience with the ESG program. And so if you'll take a moment to let us know, either you are very experienced and confident with the program, you may have some experience with ESG, you may have little experience, or no experience, or totally new to the program. And that will help us as well in understanding where everybody's coming from. And we'll allow another 10 seconds or so to respond. Okay, it's looking like some good experience from our participants. We have about 41% very experienced and confident, 41% some experience, 9% little experience, and 9% no experience. So Thank you very much. That's very helpful. Okay, we'll move on. Our first section is general information. And the Iowa Statewide ESG program. Iowa receives a statewide formula allocation of ESG funds from HUD, managed by the Iowa Finance Authority. In all HUD communications, IFA, or the state, is a grantee. Provider agencies, such as all of you participating, are sub-grantees. So that becomes important when it's time for reporting and that sort of thing, and it can be confusing what sub-grantees are responsible for. So just a note there. Entitlement cities. For ESG, those are cities that receive an additional allocation directly from HUD. And for the ESG program in Iowa, that includes Des Moines and Sioux City. These cities make their own separate sub-grants with the direct allocations they receive. However, agencies in those cities can also receive money from the statewide grants. And so the information you're going to hear today pertains to the statewide program. Okay, purpose of the ESG program. Purpose is to help people quickly regain stability and permanent housing after experiencing a housing crisis and or homelessness. And priorities, these are the federal priorities, HUD's priorities for the ESG program. And a lot of this will be review for many of you that indicated you had some pretty good experience with the program. But it is to broaden existing shelter and homelessness prevention activities, to emphasize rapid rehousing, to help individuals quickly access permanent housing, to help people regain stability in permanent housing after experiencing a housing crisis and or homelessness, to align ESG regulations with other HUD programs, and to support more coordinated and effective data collection, performance measurement, and program evaluation. For a funding overview, that's this year, just a little over $2 million in ESG statewide funds were granted out to 24 agencies across the state for the current 2014 program calendar year. 15 of those agencies were funded to do homelessness prevention and or rapid rehousing. 15 agencies were funded to provide shelter and or street outreach. You can see that adds up to 30. So several of those agencies are doing both homelessness prevention and or rapid rehousing and shelter and or street outreach, which is just fine. Still, we only make one grant per agency, but an agency can certainly do multiple types of assistance. For this current calendar year, we are using federal fiscal year 2013 HUD funds. The term of this year's grant, it is a calendar year, January 1st through December 31st. At the end of the year, if agencies have not spent all their funds, they are sort of recaptured by ISA to be granted out to future programming, so we do not allow carryover directly by subgrantees. And just a note, spending, which for us indicates accurate planning, if you're spending what you said you were going to spend in your grant, and other aspects of grant management, such as sending contract documents on time, submitting draw requests on time and with appropriate documentation. All these elements are tracked and scored in future grant competitions. So it's something to be aware of there. Spending was a little more difficult in the 2013 calendar year, so we did have quite a bit of carryover. That will be added on to next year's grant, which I think we talked about a little more later on. Okay, use of funds. Relevant guidance and rules, we have several sources if you have questions. First, we always must follow in every case the HUD Emergency Solutions Grant Interim Rule. At some point, we know HUD will come out with final regulations that will replace the interim rule, but we have no idea when that might be. Sometimes they have talked about reopening the interim rule for comments, but we first heard about that over a year ago and still have seen nothing about it. So it would be great if they do. I certainly would have lots of comments to send in, and we'll certainly be in touch if we ever hear that, but just to be aware where we are with that. Emergency Solutions Grant contracts. all agencies have their contracts now. I think everything's executed and completed and finished and back at agencies, so refer to that. Good source of information. We also have Emergency Solutions Grant Iowa administrative rules, and there's some links here. Again, we'll provide the slides later and the recording, so you can check out the links later, but I don't think we'll go to all the links during our presentation today. But the Iowa administrative rules are much shorter than the federal interim rule. They just provide a little more detail about how we actually manage the program at the state level. And then, of course, another system or another source for information about guidance and rules, what you should be doing for the program. You can refer back to the HAP system, which is our online application system. You do want to be following, for the most part, what you said you would do in your grant. Now, if you were funded for less than the total, then you might not be carrying out all the activities that you indicated you would like to in your grant proposal. But that is yet another source of information. Okay, moving on. Inspections and monitoring, just briefly. Monitoring takes on a couple different forms. Monitoring can be desk monitoring, and that's whenever you send in your information to Judy to get paid. It can also include on-site monitoring. And so this last year, I think we ended up visiting probably about 2/3, about 17 of the 25 or so ESG agencies that were funded. So certainly our intention is to pick up where those left off. And if your agency didn't receive a visit last year, but you've got ESG and you have it again this year, very good chance you can look forward to seeing Josh McRoberts or somebody else on our team. So usually we will let you know in advance of an upcoming monitoring visit, and they'll typically include a review of client files, selected client files, which we'll select on-site, take a random sampling on-site. Review of agency documents such as current financial statements, most recent audit, personnel and financial policies and procedures, staff organizational chart, job descriptions for key staff members, etc. And the goal is, of course, to ensure that agencies are in compliance and just to share information so we better understand where maybe additional training is needed. Certainly one use. Okay, and just a bit more about that. I thought it might be helpful to share what were the areas of fairly frequent monitoring findings or concerns last year. And so you must keep a record of potential clients that were classified as ineligible for assistance. This is different than if your agency is full. If your agency is full and somebody would be eligible but there's just no room for them, HUD doesn't require that, but they do require, if a client is determined to be ineligible for ESG, you must keep a written record of that. Fair housing poster, there's a link here. If you don't have it up in your shelter, you need to get one up. Shelter is considered housing, and you must follow fair housing practices. Fire alarm system at shelters must include a plan for hearing impaired residents, and so one option that some agencies have implemented is having a mobile unit that can be deployed when needed. Written policies and procedures. Now HUD has written policies and procedures requirements that apply to every type of assistance offered through ESG, so you want to be aware of those, and we'll have some more slides on those as well. You want to have written leases and written rental assistance agreements if you're providing homelessness prevention or rapid rehousing assistance. Note that those are two different things. A lease is between the client and landlord. A rental assistance agreement is between the client, the landlord, and the agency offering assistance. And then you want to have the termination of assistance and appeals process. And so you also want to be able to document that clients have been made aware of the process. So what works probably fairly simply and easily is just having, just adding that to your intake paperwork and having clients sign off that they've received the policy at some point. Okay, we just have a couple more slides here, I think, on general information, and we'll stop to take questions here in a moment. Okay, so back to those required policies and procedures. If you're doing street outreach, it's maybe just a little easier, a little fewer requirements for written policies and procedures, but here's the one. You have to have written policies and procedures that describe your standards for targeting and providing essential services related to street outreach. Okay, if you are providing shelter, you need to have these 4 written standards or written policies and procedures for these 4 areas. Evaluating eligibility for assistance, coordination among service providers, determining admission, diversion, referral, and discharge. And the last one is assessing, prioritizing, and reassessing needs for essential services related to emergency shelter. And I'm not going to go into all the detail behind each one of those, but it is available for reference later. We also have these on a handy Word document. If anybody doesn't have procedures developed and is interested in having a tool that may help there to organize, just let us know. Okay, next one, if you are providing homelessness prevention and or rapid rehousing assistance. Again, I'm not going to go through all the small fine print here, but just the general categories: evaluating eligibility for assistance, coordination among service providers, prioritizing assistance, determining client share of costs, determining the length of rental assistance, which your agency will provide, and determining the type, amount, and duration of housing stabilization and or relocation services that your agency will provide. Okay. And then I think our final slide here for just general information. We do have a requirement for quarterly ESG conference calls. Our first one is coming up on March 18th. And so it is required that all subgrantees have a representative participate. Please be prepared to contribute a recent challenge, success, tip, or question for the group. We really try to make these as interactive as possible. And I think subgrantees can learn a lot from each other. So please be aware of that. And so they're always at 11 o'clock a.m. on Tuesday, the 3rd Tuesday of every 3rd month, beginning in March. So here is the schedule. And we did send out a notice and Outlook invitation for all 4 of these dates recently. If you are missing that or your agency didn't receive that invitation, contact Josh McRoberts to be added to our email list. Okay, we'll stop there for just a moment and catch up on any possible questions that agencies have so far. Okay, and see, I'm not sure we have any questions yet, but so bear with me for just a moment. Okay, great. Doesn't look like we have any questions so far, so we will go ahead and move on. Our next section is budgets, draws, and documentation.
Good morning, everybody. This is Judy, and I'm going to go over the budgets, draws, and documentation. The first slide here shows that there are 5 ESG budget categories. First one being outreach, second one shelter, and then homeless prevention, rapid rehousing, and data collection. And then there are subcategories under the last 4 of them. Under shelter, there's essential services and operations. And under homeless prevention, you have rental assistance, housing relocation and stabilization, and housing relocation and stabilization services such as case management, mediation, and legal services. And then same kind of services under rapid rehousing. Indirect costs are also allowed. The indirect costs are different from admin costs. Indirect costs can be taken as a percentage of any category approved for direct cost. Use the indirect cost rate approved for your cognizant agency. If you don't have an approved indirect cost rate, you may still be able to capture indirect costs. But for guidance on how to do so, please review HUD's HOPWA Financial Management Training Guide. It's an online tutorial, and there's a written manual, and we show the link here for the online financial management training. HUD has recommended this HOPWA guidance for many of their other grants. It's not just for HOPWA. And you must follow the OMB circulars that we have listed here. Make sure that you do not count direct cost and indirect cost. That would be doubling up. Don't double count them. Many agencies applied for and received grants in specific categories. HUD has limits on each category for the grant overall. Changes may sometimes be allowed between categories for subgrants, but not always. Agencies should follow the categories of their approved grant. Budget forms were sent out to all the agencies, and in case you didn't get it, you can contact me, and they will also soon be put online on the IFA website. Budget draws and documentation. Budget revisions. If an agency wishes to revise the budget, they should contact IFA in advance. Budget revisions are almost always allowed within categories, such as moving funds from homeless prevention services to homeless prevention financial assistance. And budget revisions are usually allowed between categories such as street outreach to shelter or shelter to outreach, homeless prevention to rapid rehousing, or vice versa. Budget revisions are often allowed between street outreach or shelter to homeless prevention or rapid rehousing. Now sometimes we have to take into consideration what is happening overall with the grant, but we will sometimes allow revisions from homeless prevention or rapid rehousing to street outreach or shelter. Your draw request for reimbursement should be made monthly, but they must be at least submitted quarterly. And the quarterly deadlines are April 30th, July 31st, October 31st, January 31st, 2015. And send them to my attention at the Iowa Finance Authority, and there's my email. You can email them in or mail them in, whichever works for you, or fax them in. Some people do that. All of your draws must be accompanied by appropriate and complete documentation. Each draw must document the use of applicable matching contributions during that draw period. The source of the match contributions must also be documented, but it may be documented once in advance. As an example, if you received a grant from another agency for a whole year, you could send that copy of that grant in to me, and that would take care of it for the year, and you wouldn't have to document anything more. Each draw must also include the applicable data report for the time period since the last draw. Budgets, draws, and documentation. Matching contributions. There are two elements that you must match. First, the source, and then the use. The source could be cash or non-cash, and the use must meet all requirements that apply to the ESG funds. You must document this on the draw request and submit it along with the draw. Matching contribution sources of cash could be federal, state, local, or private foundation grants or other contributions. If you're using a match of another federal grant to match ESG, you may not use ESG to satisfy a match requirement for that grant. For non-cash, you could use the value of real property, such as the owned building, equipment, goods, or services. That would be provided if the recipient had to pay for them with grant funds. The cost would have been allowable. You must use reasonable calculation to determine the fair market value, and for services should be valued at rates consistent with those ordinarily paid for the similar work, such as the volunteer hours. You would use the dollar amount for that type of work that they volunteered for. There is some information on the HUD FAQ site, and here is a link to that FAQ. Examples of match using LIHEAP from HUD. Here's an FAQ guidance on that LIHEAP matching fund. And basically it says that households that do not qualify for ESG would not be eligible, that received LIHEAP would not be eligible as a matching contribution for ESG. However, the portion of LIHEAP funds that was used for program participants who were eligible for ESG may be counted as a matching contribution in terms of documentation. The same documentation requirements that apply for ESG funds apply to matching funds. For documentation standards, you need to document the client's eligibility and evaluation. Were they homeless, near homeless? Document that status, document their income. Need third-party documentation is preferable. Document staff time worked on the project by signed timesheets based on total time worked, payroll reports, etc. Document other expenses through invoices, receipts, canceled checks. Document all expenses for matching contributions as well. You need to keep this documentation in the file. Document their at risk of homeless status. In the order of preference, third-party documentation would be first choice, intake worker observations second, certification from the person seeking assistance would be third choice. Already available documentation is discharge paperwork and HMIS service transactions.
Okay, our next section is types of assistance, and before we go on to that, we'll just do a quick check to see if we've received any questions at this point. If not, I'm just going to assume that this is mostly reviewed so far. Okay, in our next section here, types of assistance, I think this section is likely to be much reviewed, so I am not going to go in detail too much on each of these slides. We'll try to be brief on these. Okay, before determining what type of assistance you're going to offer and how that fits in with your program, you first need to understand the homeless definition and the at-risk of homeless definition that HUD uses. So here is the definition, or the homeless definition. There's a link at the bottom for the full detail from HUD. We basically have four categories for homeless. And so we have the first one, which is literally homeless. The second one, which is individuals or families who are imminently homeless within 14 days. The third, that should be a 3 rather than 2 2s. The third one is unaccompanied youth or families with children or youth who meet the homeless definition under another federal statute plus 3 additional criteria. That's kind of a complicated one. And the fourth one is individuals or families fleeing domestic violence that do not have subsequent residence resources or support networks to assist. And so if a client is actually homeless, that means they can be served with street outreach, shelter, or rapid rehousing. They can't be served with homelessness prevention because they're already homeless. They can't prevent it if they're already homeless. So that's where that fits in. And again, there's a link for more information. I'll stop there. For at-risk of homelessness, this is the one that applies to agencies providing homelessness prevention. they're not homeless yet, so they're at risk. They can be hopefully prevented from becoming homeless. And so 3 categories there that HUD refers to, individuals and families, unaccompanied children and youth, and then the third one is families with children and youth. Okay, for street outreach, we just have 1 or 2 agencies, I think, doing street outreach with ESG. So this is for unsheltered individuals and families. This overview of the eligible activities, a variety of essential services that can be offered to eligible participants. And there's some more detail here, which I won't go into. Okay, emergency shelter. There are certainly many more agencies providing emergency shelter. And so the different kinds of essential services that can be provided for clients who are in shelter are listed here. They are case management, child care, education services, employment assistance and job training, services for special populations, life skills, mental health services, substance abuse treatment, transportation, outpatient health, and legal services. And if for any one of these that you are offering, HUD has a variety of different requirements, and so certainly you want to be aware of those, especially for something like mental health services. Actually, for any one of them, there are just some kind of particularities that HUD has in mind. It has to be only if they're not available from another agency providing mental health care already, things like that. Okay. Shelter operations, that's the second category available through the shelter category. This is to operate and maintain shelters. It's also if an agency is providing emergency lodging, such as through hotel or motel vouchers, which are only allowed if there is no appropriate emergency shelter that is open and available. And so the kinds of expenses that would go under operations are listed here. That can be maintenance, which would include minor or routine repairs. Does not include things like capital improvements that add to the value or life of the building, such as, say, a new roof or new windows. That's not going to fall under maintenance. That would be a capital type thing. So that's not going to be allowed. But maintenance is rent, security, fuel, insurance, utilities, food, furnishings, equipment, supplies that are necessary, and then again the hotel or motel vouchers. Okay, and transitional shelters, how do they fit in? If you're a transitional shelter that's receiving ESG, you probably know this, but your agency is only allowed to receive a grant through ESG if you have kind of grandfathered in. If you've received an ESG grant under the previous emergency shelter grant rules, then that would be a possibility. And again, if this applies to your agency, then likely you already realize that. So there are some kind of different rules with that with the new ESG interim rule. Okay. Moving on to rapid rehousing and homelessness prevention. Eligible program participants, for rapid rehousing only if they qualify as literally homeless. Homelessness prevention, this is back to that at-risk definition. A note about homelessness prevention: to serve a client with homelessness prevention, they must have an income below 30% of AMI. That gets very confusing about this at or below 30%. Probably doesn't apply to very many individuals that are exactly at AMI, but if they are, they don't qualify for homelessness prevention, have to be below 30% of AMI. For rapid rehousing, want to help someone with rapid rehousing, don't have to assess their income. They do not have to be under 30% AMI at the time that you first serve them. I think there's a slide on that later on. Okay, eligible activities, short and medium-term rental assistance and housing relocation and stabilization services, and staff salaries related to providing this assistance. Okay, homelessness prevention. This is, again, to prevent homelessness. Eligible participants, that's what we were just referencing there, the area median income requirements. And eligible activities, housing relocation and stabilization services, and the actual rental payments to landlords, short and medium-term rental assistance. Okay, rapid rehousing. This is if someone is homeless, but similar types of assistance otherwise as homelessness prevention. Okay, housing relocation and stabilization services. This is not the rental payments that are made to landlords. This is the other kinds of assistance. So it can be financial assistance of a variety of different types, moving costs, rent application fees, security deposits, last month's rent, utility deposits, utility payments. The services in support of stability would include housing search and placement, housing stability case management, mediation, legal services, and credit repair. Okay, and requirements and restrictions, a bit more here. Participants do need to meet with a case manager at least once a month for the duration of assistance, unless you are providing services that qualify under the Violence Against Women Act or the Family Violence Prevention Services Act. So that's going to be mostly applicable to domestic violence service agencies. And participants must be assisted through this monthly case management in obtaining appropriate supportive services like medical or mental health treatment or services essential for independent living. And of course, helping clients to access mainstream benefits that will help them achieve long-term housing stability, such as Medicaid, SSI, or TANF. Okay, and there's a bit here about the types of rental assistance and the length of assistance that's associated with each one. I think most agencies are doing short-term rental assistance, which is up to 3 months. I think very few agencies at this point are doing longer assistance than that, but you can. Just need to have it again in your written policies and procedures. What are your standards for how long you provide assistance? Payment of rental arrears, you can pay a one-time payment of up to 6 months of rental arrears if that's going to make the difference in someone being able to achieve or maintain stable housing. And for any combination of the 3 types of rental assistance, it may not exceed 24 months during any 3-year period. Okay, stopping there for a moment. We're going to move on to program requirements soon, but we are just going to do a quick question check. And it looks like we have just a couple questions here, so we'll check those out. Let's see, someone is asking, I thought that the documentation for homeless verification was no longer going to be needed. Whoever is asking that, if you could provide more detail on where that's coming from, or maybe just a little more about what you mean there. I'm actually unsure how to respond. Definitely documentation for homelessness is mandatory. That's a federal requirement. That's an important one. Definitely, I think probably the first priority in knowing that someone can receive assistance is being able to document that they are homeless or at risk of homelessness for homelessness prevention. So again, if you could just shoot us to maybe just a bit more of what you had in mind there, that would be helpful. Okay, and then can transitional housing programs still qualify under Category 1 homeless and therefore be eligible for rapid rehousing? Okay, so what do you want to know if you're a transitional shelter or housing program? As far as the ESG program is concerned, you are shelter. That's just that simple. You are shelter. And so HUD doesn't have any particular different rules for transitional housing providers under ESG because as far as HUD is concerned, you are grandfathered in as a shelter. So, but again there, if you want to provide more information, if I'm not quite answering it, there may be more to that question that we haven't thought through. So let us know. Let us know there. I'd be glad to have an additional conversation there. Oh, good. Okay, so let's see. We had a little clarification on the homeless documentation. Let's see. The participant says, I think it had to do with not needing that homeless documentation because of data sharing that we'll be doing with a coordinated assessment system that is being implemented. Okay, so interesting question. So I think that's something that in the coordinated assessment system, we don't have all the details ironed out yet. And so once that coordinated assessment system is in place, We will be moving to requiring it for ESG, and at that time I think we'll have a lot more training on what that means, how that impacts our documentation requirements, how that impacts all other aspects of how the programs are run. But certainly until that's in place, please just continue to document things as you normally would. My guess is that once the coordinated assessment system is in place, we'll still need that same documentation, but it might just be easier to obtain. It might be that you'll be able to get the documentation straight out of the HMIS system, for example, rather than having to do more legwork in obtaining verification otherwise. It's possible that's how it works. I don't know if maybe Julie Eberbach or someone else from the Institute is on the webinar, and or anybody else that's real familiar with the coordinated assessment system development would have other comments there. But that would be my guidance so far for that. Okay, interesting. Okay, so maybe some clarification there as well, or additional information about rapid rehousing and transitional programs. So further information: this agency is doing rapid rehousing for the community, but they don't do transitional housing themselves, and they want to be able to help those exiting transitional programs. That is a great question. I do not want to answer that wrong, so I would like to do a little more research, and I certainly will follow up so that we can be clear about that. So again, would be the question: if a client's exiting transitional housing, could they receive rapid rehousing assistance? Really good question. We'll follow up. Thank you very much. Okay, very good. I think we'll move on, and please just, as you're thinking of questions, whatever comes to mind, send them our way, and we'll keep addressing them. Our next section is program requirements.
All right, good morning, everybody. This is Josh. I think this will probably be mostly review as well, so I'll try and abbreviate where possible. But before I start, I just want to say these will be things that either I or Judy will be looking at when we come and monitor for grant compliance. So keep these in the back of your mind. So first, for religious organizations, we all know the agency can't engage in religious proselytizing or counseling using these ESG grant funds, nor require attendance at religious services, nor limit services or give preference to persons based on religion. Accessibility. The grant-funded program must be accessible and usable by individuals with disabilities, and you must provide reasonable accommodations. If a shelter isn't accessible and can't be reasonably retrofitted, such as it being a historical building, you need to develop written procedures for alternative accommodations to serve disabled individuals, such as an agreement with another agency to take those disabled individuals. Coordination with other homeless services and access to mainstream resources. You must coordinate to the maximum extent practicable grant-funded activities with other homeless service programs in your community. The agencies must ensure that the participants are assisted in obtaining mainstream services and benefits that include at least housing, health care, social services, employment, education, and youth programs. Termination of assistance. The subrecipient must implement formal notification and an appeals process for termination of assistance to individuals or families who violate program requirements. Below is what that policy must include. And the agency may resume assistance to a family or individual whose assistance has been terminated. You should document that a client has received notice about the policy, and the client may sign an acknowledgement statement with other intake paperwork, such as what Amber had mentioned earlier. Record retention. The ESG regulation requires that records are retained for a minimum of 5 years beyond the end of the grant term. Records must be accessible and open to inspection at any time by IPA, its representatives, the state auditor, HUD, or any representative of HUD. and records may be in an electronic format provided that they are readily accessible for inspection. Conflict of interest, organizational conflicts of interest. There's a provision of ESG assistance may not be conditioned on an individual's or family's acceptance or occupancy of emergency shelter or housing owned by the organization or a parent or subsidiary of the organization. Individual conflicts of interest, no person or their family member or business partner who exercises authority in activities assisted with ESG may obtain any benefit from the program or activities. An example of that would be an agency director owns personal property. It's available for rent, and the agency directs a client to that property and provides rental assistance to move into that property. Confidentiality and release of information. The agency must implement procedures to ensure the confidentiality of records for any client provided family violence prevention or treatment services. The agency must protect against the release of the address or location of any family violence shelter, except with written authorization of the person responsible for that shelter's operations. What should you do? All clients that receive assistance from ESG must sign a release of information that allows the subgrantee to provide information to necessary organizations such as IFA, the Iowa Institute for Community Alliances, or the Iowa Coalition Against Domestic Violence, and also HUD. Please develop written security and confidentiality policies if you do not have them. Involvement of homeless individuals. I think this kind of comes up too during monitoring. A lot of agencies aren't sure exactly how to involve homeless individuals. And to the maximum extent possible, the agency must involve, through employment, volunteer services, or otherwise, homeless individuals and families in the following manner: constructing, renovating, maintaining, and operating facilities assisted with ESG funds, providing services with ESG funds, and providing services for occupants of facilities assisted with ESG funds. And these are current homeless individuals that you're assisting, not past clients that you have assisted. Some examples would be client helps with answering phones and staffing the front desk. Clients help maintain laundry and clean facilities. Clients help prepare meals. And an advisory board of homeless or formerly homeless clients helps develop policy and procedures for a shelter or service provider. Habitability standards, I'll kind of just hit a few of these. The lead-based paint visual inspection and remediation disclosure applies to all shelters and housing occupied by ESG participants. For homelessness prevention and rapid rehousing, this applies to properties built before 1978 and is a property in which a child under the age of 6 or a pregnant woman will be living. And we have a link to the HUD online training course for lead-based paint inspection and remediation. The minimum safety, sanitation, and privacy standards are listed below. A few are just structure and materials, water supply, thermal environment, illumination, electricity. All of those need to be assessed for habitability. Other requirements of the ESG program include non-discrimination and equal opportunity, fair housing, non-discrimination by age, affirmative action, affirmative outreach, job training and employment for low-income residents, drug-free workplace, contracting with federally eligible entities, lead-based paint, and OMB Circular A-133 regarding federally required audits of nonprofit organizations. There are some additional program requirements for homelessness prevention and/or rapid rehousing assistance. For instance, an initial evaluation is required of all households to determine eligibility for ESG assistance and the amount and type of assistance necessary to regain stable housing. Reevaluations are required for participants receiving homelessness prevention at least once every 3 months and for rapid rehousing at least once a year. For homelessness prevention, income must be below 30% area median income at intake, And for rapid rehousing, income must be at or below 30% area median income at annual recertification. Documentation of income. There's a range of documentation types and in order of preference, first being written third-party and intake worker of observations, second oral third-party, and third self-declaration. Calculation of income, annualized current, hourly, weekly, or monthly payment information as appropriate. This is different from HMIS data entry requirement to enter income information for the past 30 days. Please compare against the area median income, and we have a link there in which you could do that. Keep documentation in the case file of household income and relevant area median income. Fair market rent. We also have a link there for you to determine fair market rent for your area. I believe it's broken out by county. Is that right? HPRR rents, unit rents, cannot exceed the FMR for the area in which the unit is located. Steps to take: document in the client file how many people will be living in the unit, document the size of the unit, document the county the unit is in, and document whether the unit is within the established FMR for that county. Include the relevant FMR. Rent reasonableness is something that must be used in addition to fair market rent or FMR. The total rent charged for a unit must be reasonable in relation to the rents being charged during the same time period for comparable units in the private unassisted market and not be in excess of rents being charged by the owner during the same period for comparable non-luxury assisted units. It's similar to a property appraisal. And the regulation we cited at 24 CFR Part 982.507. New, starting this year, is the iowahousinsearch.org, in which you can list and look for rental housing all across the state. It's free to do so. Some more on rent reasonableness. The same time period, units currently available for rent, units rented to the current tenant within the last 12 months. You can use comparable units that were surveyed within 12 months, comparable 3 units. If you can find 2 but not 3 comparables, document effort to find third. Sample policy would be the agency maintains a file which includes data on unassisted units for use by staff in making rent reasonableness determinations. The data is updated on an ongoing basis and purged when it is more than 12 months old. Leases, very important to have in the client file. It's required for rental assistance. Must be legally binding and a written lease. Must be between the property owner and the program participant. If solely for rental arrears, can be an oral agreement instead of written, if sufficiently documented by an owner's financial records, rent ledgers, or canceled checks. Rental assistance agreement, this is what Amber noted as being different from the lease. It's required in all cases of homelessness prevention and rapid rehousing assistance. This is between the agency, the subgrantee or subrecipient, and the landlord. It must contain terms of the rental assistance, a provision that during the term of the agreement, the landlord must give the agency a copy of any eviction notice or complaint used to commence an eviction process against the program participant. The same payment due date, grace period, and late payment penalty requirements as the program participant's lease. And any late payment penalties must be paid by the agency with non-ESG funds. Non-ESG funds. Agency could come up with a short, customizable form for all rental assistance agreements. Keep these completed forms in the client files. And we here at ISA have been drafting a possible rental assistance agreement form that could be used by all ESG subgrantees if they would like, but we will let you know more about that as work continues. use with other subsidies, rental assistance cannot be provided to a participant receiving tenant-based rental assistance, TBRA, or living in a housing unit with project-based rental assistance through other public sources. You could, however, provide deposit assistance for someone moving into Section 8 housing or something similar. The exception is a one-time payment of rental arrears on tenant's portion of a rental payment. Case management, the client must meet with each program, the agency must meet with each program participant at least monthly. You must develop a housing plan for each program participant and focus on how the participant will retain permanent housing after the ESG assistance ends.
Okay, our next section is data collection and reporting, and we'll take another brief break here and see if any other questions have come up. Okay, I don't think we have anything at this point. Excellent. Okay, data collection and reporting.
Hi, this is Judy again. I will go over this data collection and reporting section. Why it matters. For federal funding, it's for programs overall. You must meet certain standards for data completeness and quality. Even if a program isn't receiving federal funds, we still have to report certain information about the program to HUD and the Continuum of Care program. Competitive funding is impacted by this. Planning. Providing measures of what kinds of programs, services, and interventions are most effective. Identifying areas of greatest need for certain kinds of services. Data completeness and quality are monitored with each reimbursement request. Data completeness, quality, and timeliness are assessed and scored in the annual ESG competitions. Requirements. Required participation in a homeless management information system, or HMIS, is a federal ESG requirement. Iowa's statewide HMIS system is the Service Point iCount network. The HMIS system is managed by the Institute for Community Alliances. There's an exception for domestic violence agencies. Agencies whose primary mission is domestic violence victim services. They cannot participate in HMIS. Domestic violence agencies must use a comparable database that produces unduplicated aggregate reports. The current database for most agencies is ALICE, although this may be changing later this year. Data is entered in accordance with HUD's HMIS data standards. Enter and report information for clients served through ESG Match. HMIS training. All HMIS training is managed by the Iowa Institute for Community Alliances. All users of the iCount network must attend training provided by the ICA in order to obtain access to enter the data. New ESG subrecipients should contact ICA for details of training dates and locations. Past ESG subrecipients may need additional training depending on their type of ESG activities. As an example, if providing shelter before but now are providing rapid rehousing and this is new, you must contact the Institute for Community Alliances. And this slide shows the contact information, and get a hold of Kimberly Murphy for dates on training and other requirements and how to register for training. Another reporting function is the ESG CAPER. The Consolidated Annual Performance and Evaluation Report is known as CAPER. There are additional requirements as of last year. This is submitted to HUD at the grantee level, which is us here at IFA, the state of Iowa, not by subgrantees directly. It includes client demographic and utilization data, types of services provided, expenditures by category, match information, and identification of subgrantees. Two sources of client data are HMIS and DV databases. HMIS data comes in aggregate form supplied by the ICA, and DV data is submitted by individual agencies.
Okay, thanks, Judy. We'll take, that was kind of a brief section there, but we'll stop in for just another moment and see if we have questions. Okay, and I don't believe we do. Oh, great. Okay, future outlook. This is a section that I suppose is probably mostly new of all of them. So, okay, we have first of all best practices and standards development. This is kind of an ongoing challenge and mission of this program and others. So there's a current initiative of the Iowa Council on Homelessness called the Best Practices for Iowa's Homelessness System. It's led by the State Public Policy Group, or SPPG. This was through a legislative appropriation to the council last year for about $50,000. And so through this effort, a statewide planning advisory committee has been developed. This is following a number of regional kind of planning and input meetings that were held in various communities around the state back in December. And so since then, the statewide planning advisory committee has met once for an all-day meeting. Was scheduled to meet again yesterday, but the weather interfered there, so that's delayed. This statewide planning advisory committee is going to report back with their full results to the Iowa Council on Homelessness this summer when the initiative is complete. At that point, the group will have identified recommended standards in 3 areas, and these 3 areas are services for different kinds and types of programs, operations, and performance. And so, let's see, this will likely impact future ESG program development and more. So kind of an exciting project going on there. And for more information, you could certainly contact anyone at the Iowa Council on Homelessness. You can contact me, or you can contact the State Public Policy Group directly, which is our Linda McKean. Okay, as far as other efforts to develop ESG-specific standards, it really kind of depends on what the recommendations are that come out of that current SPPG or Iowa Council on Homelessness initiative. From there, we'll have a better idea of what other ESG-specific standards we may need. And just the longer we work with the new interim rule for the ESG program, the better we understand where there are areas of need where it would be helpful for agencies to maybe have some common forms or common approaches, or just the idea is really just to provide the best services possible, of course. So just kind of a mundane example, but that has been requested by agencies and that HUD has sort of promoted is having common rental assistance agreement forms. Okay, other ideas with future outlook, greater collaboration with COCs or continuum of care bodies. HUD requires this of ESG grantees. As of the new ESG interim rule and continuum of care interim rule that came out in the last couple of years, ESG grantees must consult with the continua of care, or continuums of care, if you prefer, within the geographic area served. And so the 3 COCs within Iowa are the Balance of State, Des Moines, Polk County, and Sioux City. And then over in Council Bluffs or Pottawatomie County, they go on over to the Omaha side. So, but for those that are within Iowa, there are 3. And the consultation is to include how funding is allocated or prioritized for eligible activities within ESG. It should include the development of performance standards for ESG, which HUD has not been real particular about for ESG yet. I'm not sure how particular that will eventually be, but certainly for our state and our COCs, we should be developing our own as well. It should include evaluating outcomes of ESG-assisted projects and what that looks like on an ongoing basis to evaluate those outcomes. Right now, we mostly do that through just the annual application process for ESG. The consultation should also include developing funding, policies, and procedures for the administration and operation of the HMIS. Okay, and moving on, but just a little bit more here about collaboration with COCs. The place that this happens in the most significant way for the Iowa statewide ESG program is with the Iowa Council on Homelessness, and that's due to two important capacities that the council serves in. They are, first of all, a statewide advisory body, which includes all COCs, and secondary, they are the decision-making authority for the balance of state COC, which is most of the state. So both I think, important roles, and so that makes them the main body that we consult with for the ESG program. The Iowa Council on Homelessness, a bit about that if you're not engaged or aware of how that happens. The council meets every other month on the third Fridays of those months at 10 o'clock a.m. January, March, May, and July, September, November. They meet in person at the Iowa Finance Authority or by conference call. Materials are always available online in advance of the meeting, so you can follow along if you're by conference call, or through the ICN or the Iowa Communications Network, yes, our teleconferencing network, or video conferencing network rather, throughout the state. There's always several locations for the ICN, so you can participate and actually see the meeting, what's going on in your area. So anyone can join in and contribute. Voting is by the 38 officially appointed members, but certainly anyone's welcome to join in at any time. Okay, just a little more about rapid rehousing. There's some additional rapid rehousing opportunity through the Continuum of Care program. And so if you're an ESG agency that does rapid rehousing already and you want to do more of it, or if your community wants to do more of it, or maybe you don't do any rapid rehousing in your community but you want to start, ESG is one source of funding for rapid rehousing. As of just a few weeks ago, the COC program is another easier source to use. The COC interim rule allowed for rapid rehousing, but as of a couple years ago when it was first launched, it required that only government agencies or public housing authorities could actually administer the rapid rehousing. So that was just kind of created this hurdle for a lot of nonprofit agencies that were interested in rapid rehousing. As of just a few weeks ago, HUD made a technical correction to the regulation that changed that, so at least through 2014, federal fiscal year 2014. So that would include this coming year's Continuum of Care application for the 2015 year. So, and after that, we don't know. My hope is that HUD would not extend this possibility to nonprofit agencies, only to rescind it the following year. So if agencies can show that this is a helpful and productive thing to do through the COC program, then that will probably be helpful in getting extension past this current limit. If you do look into doing rapid rehousing under the COC program, it's a complicated application process. You want to be in touch with the decision-making body for your COC about that early on. And of course, if you did end up being funded to do rapid rehousing under COC, it does have some different rules from ESG. Okay. Also, future outlook for ESG, another topic here. We will be moving towards somewhat greater, towards moderate alignment with the Shelter Assistance Fund, or SAF. And so just some history about these two programs. They used to be administered jointly together prior to about 2011, I guess. There's been some changes since then. When HUD came out with the ESG interim rule in 2012, it was different enough from that old emergency shelter grant that it just no longer made sense to combine those programs administratively. So we separated that out, and we run separate competitions for the programs. Agencies can only get one or the other type of grant. They do support some similar programs, but quite different as far as the regulatory requirements right now. In the next few months, we will be seeking significant changes to SAF. It is very clear to us, to the SAF administrative roles, it is very clear to us that some greater rigor is needed in the SAF program, some greater clarity, and some greater alignment with ESG, since again, these do support similar programs and agencies. What I think is probably very difficult for subgrantees is if they receive ESG one year and then SAF the next, and then back to ESG, they're just, the regulatory requirements are different enough that I think that's probably very confusing and just maybe not that helpful for anybody. So we probably will not go towards making SAF identical to ESG. In fact, I'm sure we will not do that, but we will strive to make changes where it makes sense. So that's the whole process. Changing the administrative rules entails requirements for public comment and all that. And so we really do encourage and value and appreciate and need comments from stakeholders that are interested in either one of these two programs. So please consider submitting comments at the appropriate time. We'll certainly have more information about that as we move along. Okay. Next topic for future outlook, coordinated intake or assessment. We already had a couple questions about that. And I've already touched on it very briefly, but it is required by HUD for ESG. It is required first for continuums of care or COCs. So that's the way it works. COCs have to develop it first. They have to develop and implement coordinated intake and assessment. And once they have a system in place and they say this is our coordinated intake or assessment system, then ESG agencies have to jump on board. So ESG agencies, some ESG agencies are also COC program funded agencies. So that would be a little different for them. But anyway, so we as the ESG grantee for the state and leading our sub-grantees, we sort of defer and wait for the COC bodies around the state to develop those systems and put them in place, and then we will go along as HUD requires. So the Iowa Council on Homelessness is working on this for the Iowa Balance of State COC. They've got a coordinated intake or assessment committee that's doing some very helpful work. Des Moines-Polk County is also pursuing their own plan. Sioux City also must take steps in that direction, which I believe they are doing. Okay, so the timeline on that is required for COCs by this August 2014. A functioning system has to be in place. As far as how extensive or rigorous it has to be, the kind of main bottom line requirement is that it has to be at least a common form, a common assessment form in use by all agencies, and it can go far beyond that. So we will see. A tool that's being looked at by the Iowa Balance of State or the Iowa Council on Homelessness is the VI-SPDAT, kind of an unwieldy acronym there, but that stands for Vulnerability Index, which used to be its own which I think still is probably a standalone tool on its own. That's assessing kind of in some standardized way how vulnerable different clients are. And then that was recently combined with another tool that also sometimes stands on its own, which was the Services Prioritization Decision and Assistance Tool. I did that from memory. I hope I got the right, spelled out right there. But anyways, so the VI-SPDAT kind of combines those two tools, which a lot of communities throughout the country are using with some success. They've been tested, shown to be reliable in assessing clients with different levels of needs. So the idea there is to move away from a first-come, first-served model where a shelter or program fills up with whoever walks in the door first. So moving away from that and towards serving those that are identified as most vulnerable and least likely to succeed without assistance. Also, along with that, moving away from long waiting lists or closed waiting lists, which inevitably happens when it's first come, first served. Anybody walks in the door, you fill up your program pretty quickly, and then you might have a waiting list that's years long. So. Okay, next, future outlook, greater emphasis on local and regional partnerships and collaboration. Of course, always local and regional partnerships and collaboration has been important, but it is just growing increasingly so, and that is both federally mandated and just probably a good idea. So first, there's partnerships between service providers, ensuring clients are served with the most appropriate type of assistance as early as possible, which of course dovetails with coordinated intake or assessment. Second is partnerships with mainstream resources or services providers. It's also about partnerships to ensure good quality and complete data collection efforts throughout communities. It's also about measuring outcomes by communities and whole systems of care rather than just solely by different agencies. It is collaborating to ensure agencies know what's available at other local agencies so they can make appropriate referrals. And eventually it's possibly about exploring new ways of funding that places or that place more emphasis on community planning together. So not sure yet what that might look like, but certainly something we have our eye on. Okay, and a little bit about funding. And we are nearing the end of our presentation today. I've had kind of a packed presentation, so thanks for bearing with us. Funding, we operate our program year as a calendar year following HUD fiscal year appropriations. So what that means is we use federal fiscal year 2013 funds in the 2014 calendar year and so forth. So you certainly don't need to know any of this unless you're really interested and unless you kind of follow along federal fiscal year kind of budgeting stuff, then maybe this means something to you. You can kind of get an idea of what different funding levels are likely to look like, and you understand how it ties in with how we run our program year. As far as the following year, as in next 2015 calendar year, recent information, it looks like we're set for a moderate increase from what's currently available. So we should know, HUD says within 60 days of, I don't know, that was probably 3 weeks ago that they said we'd probably know within 60 days. With HUD, I think they count their days a little bit differently than we do, so we'll see. We'll also add some amount of unused funds from 2013 calendar year as carryover available for the 2015 calendar year. So that means agencies from last year that didn't use all their funds, even though the agencies individually can't hold on to those funds and use those in a future year, they don't just go away. We'll add them to the amount of funds that's available to grant out in the next competition. Sioux City has kind of an interesting, little bit unfortunate thing happening this year, so we'll be working with them to see how we can best navigate through that this year. But Sioux City's entitlement funding from HUD will drop off in federal fiscal year 2014. It will return in federal fiscal year 2015 is what HUD has said, and beyond that we don't know. And so that's just about how HUD calculates the formula for ESG, which is through the CDBG formula. So that may have some impact on the Iowa statewide program in the coming year. As far as the competition for next year, for 2015 fund or for 2015 calendar year, that is likely to begin in early summer. I think we generally strive for, and have generally done at least the last couple of years, started that in early June. So we'll be shooting for that. It's possible we'll have a combined staff and ESG application this year. But lots of things to work out there if that's going to happen, so that's not definite yet. Okay, resources and more information, just a couple places here. It's not going to be real helpful except through these links. So again, make the slides available if you want to reference these. But for HUD ESG pages, HUD continues to add more information and make this kind of a richer source of help and assistance for the program. The snapshots are just a series of small kind of digestible bits of information about the ESG program that HUD has put out to provide guidance. The SNAPS Weekly Focus, that was probably a series, maybe about 12 or so, that came out in advance of last year's Continuum of Care program competition. Some of the items don't relate to ESG so much, but some of them really do. Some of them are about homeless assistance services and systems overall, and so those can be helpful in kind of getting an idea of where HUD is coming from and what HUD's priorities are for this program and others. Yeah, and then we have our ISA ESG pages, lots of information there, and then agency collaboration. I'm sure agencies are sometimes collaborating with each other independent of ISA or anything we do here at the state. But if you have forms or resources that you think are helpful, that work well for you, if you ask a question of HUD and you get a response back, send it to us. We'll be happy to share that with others, either through the website or through some other means. And just kind of general opportunities for training and professional development. Probably a lot of you are already familiar with these, but the second annual Iowa Homelessness Symposium hosted by HUD through their Des Moines office, that is in the works. It'll be coming up this summer, likely June or July, but we don't have an exact date yet. It will also likely be held again in Des Moines as it was for the first time last year at Drake University. HUD is trying very hard to make sure it's inclusive of both rural issues and more urban issues, so a little more of a focus on rural stuff this year. So be looking forward to that. It may be a little bit before we have an exact date. I think that's because Drake University is kind enough to host it for us for HUD for free, but they just it depends on the student schedule. Second opportunity, the Housing Iowa Conference that's hosted by IFA every year. The dates this year are September 3rd through the 5th, and that will be held at the Des Moines Marriott this year. Last year we moved over to Coralville, and this year we'll be back in Des Moines. The National Conference on Ending Homelessness, that's a little harder to get to, I guess. That's in Washington, D.C. That's coming up this year, July 29th to the 31st. Always packed full of information, lots of providers who come to that conference, and lots of really interesting and good ideas packed into that conference. Okay, additional training. We're interested in learning what additional training is needed. You can submit your feedback through the questions box. You can send us an email anytime. Just something to know about additional training. We did originally hold off on doing this webinar because we were trying to get HUD actually to provide just some kind of overall ESG training through their technical assistance funds. And so we requested this as kind of an official online form to request this. We received initial approval back, and then we kind of went back and forth with the TA provider that we were connected with, and in the end, things just take so much longer than we would like them to with HUD. And so that was going to be delayed far enough that we didn't want to wait on providing at least some initial training. So it's possible that will still come through, and that would be more of like we were thinking in-person, a little bit longer training to meet together, learn from one another, and go a little more in-depth in some of these topics. So it's possible this will come through, and we'll certainly let you know if so. So I think we actually have a poll. Let's see what Josh put together here for our next poll. We were interested in learning what kind of additional training might be helpful. So we'll see who's held on with us to the end of our webinar today. Okay, we'd like to know what additional training do you need, and hopefully if we set it right, you can set the poll up right, you'll be able to answer more than one of these if you need additional training in any of these topics. So again, this is not, let's see, what other areas do you need additional training in? I'll give you a moment. Getting lots of answers in. Thanks very much. And we'll just give you about 10 more seconds here to enter your response. Okay. Okay, it looks like most responses are in. It looks like 50% of you say that some additional training in budget draws and documentation would be helpful. About 50% some additional training and program requirements. Almost 50% data collection and reporting, a smaller amount with general ESG program information, and then a small amount of other. If you would send us your comments for other, if you'd send that to us in the questions or chat box, that'd be helpful. Actually, with any one of these topics, if you have more specific ideas for exactly where you have questions or where additional training is needed, that would be helpful as well. Let's see, two ways that I would look at this. So one, at least our day today hopefully wasn't wasted, because all of you say that some additional training would be helpful. So if you were all experts on the program already, then of course we wouldn't really need today. Hopefully today has been some help though, and this is good for us to know. So thank you very much for participating in that. Okay, and I think we are just about there. We have a slide here, general program questions. You can certainly always ask of HUD. Send it to their HUD help desk. You can find answers to questions others have asked. These are always, I find these very helpful to look through. These are areas where other people have thought the regulations were unclear or had questions, and so HUD has dealt with some of those. And you can ask your own questions directly of HUD, and there's a link to do that. And please, if you do that and get a response back, I know I said that before, but please do send it to us. That's always really helpful. And sometimes HUD will answer questions, but they don't actually then post all of the answers so everybody can see them. So if you got your question asked, it doesn't mean that it'll automatically go to their area where they have some questions posted. Okay, and finally, our very last slide. If you want to contact us, hopefully you know how to do that already, but here is a reminder. Contact any one of us who presented today, or if your question is about data collection through the HMIS system, we've also included Julie Eberbach's email here. And I think we have just one final poll to conclude with, and then we will move to any questions that have been submitted. And we want to know, how helpful was it today? And let's see, we have very helpful, somewhat helpful, I'm ambivalent, not very helpful, and not helpful at all. So you can give us your honest answers. I don't think we can see who submitted what. So we'll go ahead and launch this and look forward to responses there. Okay, so far nobody's been brave enough to say not very helpful or not helpful at all. So it's kind of you, but it's okay too if feeling like it was not quite what you needed. Okay, so it looks like the most common answer, 50% of you thought it was somewhat helpful, 5% ambivalent, and 45% very helpful. So I think that's helpful. Provides a decent start, so it tells us that maybe some more information or in some other format could be good as well. So send us those comments. We'd love to know more. And with that, we will go ahead to questions, and we'll just see what other questions may have come in. Okay, so one question, I'm guessing this relates to coordinated assessment or intake. This question is, do you know whether the entire, or maybe it doesn't, I'm sorry, just to back up, maybe it is just about other kinds of collaboration. But the question is, do you know whether the entire balanced estate COC will be required to work together, or will there be the ability to have smaller networks? And so I think it's both, and I think it's really unclear yet. I just don't know. I don't think anybody really knows. I think, and that means beyond even just our state. I think if the question is about coordinated assessment, it is a whole lot clearer how this works in COCs that are just, one urban area. Like, say, for example, Des Moines. That's not to say that it's not challenging, but it's a lot. It's probably a lot clearer to kind of figure out what that might mean for just one city. As far as going beyond to an entire state, an entire balance of state, coordinated assessment or intake is very different. And I think people are just really wrestling with this nationwide. And so we continue to learn. And I think at first probably what it will be is a common tool, a common assessment tool that everybody across the state is expected to use if they're funded through one of these HUD programs, and maybe the Shelter Assistance Fund as well. But as far as beyond that being referrals, a kind of more well-developed referral system that agencies are using, it's possible it'll be sort of some kind of two-stage kind of thing where there's the basic minimum level that statewide everybody has to do, and then there's just a little more in-depth degree that it happens in various communities. So at this point, I think Cedar Rapids for the balance of state has, has begun a model of coordinated intake and assessment. So we really appreciate their efforts and hope to learn a lot from them. Of course, coordinated intake in Cedar Rapids is very different than coordinated intake in a rural county as well. So, so we will see. That's a long answer, a long way of saying I don't really know yet. I'm hoping we're not going to get kicked off our webinar. I just realized that it was 11:33. I'm not positive if I scheduled it for 2 hours or an hour and a half. So if we get kicked off here, I just want to say in advance, thank you very much for participating. We'll hang on here as long as we can, as long as the system allows us to, and as long as we have a couple other questions to get through, which I think we do. So. Okay, next question. When will we be trained on how to complete the voucher forms? Okay, so this is, I'm guessing, a draw request question. If not, then send us, whoever asked this question, send us a follow-up question, please, and let us know exactly what you mean. If this is about the draw request forms, Judy Hartman is an expert and always happy to help. Contact her, and she'll walk you through that. Yeah, could say a whole lot more about that one. Mostly what's really important and what doesn't always happen is that we need to be able to tie what's requested on the reimbursement sort of cover form. We need to be able to actually read through logically and see how the documentation fits in and adds up to the totals that are requested, which sometimes it's very difficult to do. I don't think I'll say more on that right now. Okay, next question. This person, I think, is interested in model policies, probably some kind of common practices or best practices. So a tool would be great. Whoever submitted that, I'm not positive I fully understand. I don't know if that's a kind of a general comment on general tools or model policies or something specific, but feel free to send us a little more there. Oh, and then a further question, when will there be training on completing the reimbursement request form? We actually have not scheduled really detailed, in-depth training on the reimbursement process, but we can certainly consider it. If this person would contact Judy Hartman, that's judy.hartman@iowa.gov, and let us know kind of what you're thinking, what kind of training is needed, what your questions are. We can look into whether that's something that we should do on a one-on-one basis or whether it indicates a broader need that we might offer for a number of agencies. So if you would contact us, again, offline, just send Judy an email. We'd be happy to work with you on that. Okay. Okay, and then a comment, I guess this isn't a question, but one commenter is interested in hearing more about DV programs. Certainly, there's the issue of how domestic violence programs fit into the picture of coordinated intake, and of course, that being outside of the service point HMIS system, which is certainly an important consideration. So I think HUD's goal for coordinated intake is that it certainly needs to include DV agencies in the conversation and in the development so that DV agencies and clients accessing DV services are able to receive appropriate service through the system without having to, or without being part of HMIS, which of course they cannot be. So certainly consideration, certainly it's something that's being looked at by those groups that are developing coordinated intake. If anybody's interested in working on coordinated intake, and in particular if there are certain topics such as the DV issue and you'd want to be part of that conversation, that would be wonderful. For the Iowa Balance of State, I'd be happy to put anyone in touch with the chair of that committee, who is David Hagan. David Hagan is out of Cedar Rapids, works for HACAP there, the Hawkeye Area Community Action Program. But he is, he's with the Iowa Council on Homelessness, so it's a statewide effort. Anybody is welcome to join in that committee. Whether you are a member of the council or not, you can join into a committee. And so that would be wonderful to have input on that. So thanks for that comment. Okay, I don't think we have any more questions. So I know it's been kind of a long morning, I think. So it feels like a lot for us to fit in. But please keep those comments coming, email us or give us a call on what else would be helpful for you. So thank you very much for your attention. We appreciate your work with the ESG program. And take care and have a wonderful weekend. We'll be in touch.